Today we are going to treat a course called dispensing. What is dispensing? Dispensing is a very important area in pharmacy practice. Dispensing is the bedrock of pharmacy practice. Without dispensing, there's nothing like pharmacy. So without wasting time, how can we define the term dispensing? Dispensing can be defined as a process of preparing and giving medicine to a named patient on the basis of a prescription. The keywords: the patient must be named. It's not just an anonymous patient. At the same time, it must be on a basis of a prescription. You cannot just dispense in absentia. There must be a prescription that accompanies what you are dispensing. Now, another important point I want to make is that dispensing involves correct interpretation of the wishes of a prescriber. At the same time, the person that will dispense the person that would dispense the drugs or the medicine also has to be what? Accurate. There's no room for mistakes. There is zero tolerance to mistake in dispensing, because patient's life is at stake. So it has to be properly dispensed. Accuracy must be there. At the same time, it has to be properly labeled so that the proper direction, the proper name of the drug and other information that contains in the label should be properly displayed. Where do we carry out dispensing? Actually, dispensing process should be carried out in either public or private clinic, hospitals, community pharmacies, as certified, approved by the Pharmacist Council of Nigeria. For a dispenser, the pharmacist or the pharmacy technician, as the case may be, to be able to dispense properly, there are basic knowledge you should have. One of these knowledge is this: you should have the knowledge of the stability of medicines and their active ingredients. Very important. Knowledge of the principles involved in compounding. Knowledge of dosage, that is posology. Physicochemical incompatibilities as well as therapeutic incompatibilities. Packaging methods, labeling procedures, legal requirements that governs the supply, storage, labeling, and at the same time the container for poisons. At the same time, some also legal requirements for the misuse of poisons and other drugs and other therapeutic substances. These things are very, very important knowledge you should acquire for you to be able to do what? Dispense properly. There's something about pharmacy. Pharmacy is an integrated course of study. Now, for you to be able to acquire this knowledge that will help you to dispense properly, there is what is called integration of different disciplines for you to be able to acquire this knowledge. And these disciplines are as follows. Number 1 is chemistry. Number 2 is pharmacology. Number 3 is microbiology, pharmaceutical technology, forensic pharmacy. It is not limited to these course of studies I have outlined. But let me go deeper into each of these courses or area of studies I just outlined, so you can understand how application of these things will help in the acquiring knowledge necessary for proper dispensing. The knowledge of chemistry will go a long way to help the dispenser or the compounding pharmacist or pharmacy technician to be able to know the stability of each of the ingredients, or even at the same time the active ingredients. It also help the technician or the pharmacist on the knowledge on how to compound, how to package. Yes, because most of the packaging materials are made of chemical entities. There are some properties of them that you need to know from the knowledge of chemistry. At the same time, detection of the chemical and physical incompatibilities of the active ingredients at the same time, and that of the excipients or other ingredients. So as you can see now, chemistry is very important. Now let's go to pharmacology. Pharmacology will help the dispenser to be able to know the dosage and even the therapeutic incompatibilities. What am I even talking about? How can you talk of dispensing without even knowing the pharmacological effects of what the active ingredient you want to compound and dispense? So pharmacology is very important. Another one is microbiology. You know, microbial degradation is a very, very big problem in compounding of medicine. So having a knowledge of microbiology will help you to prevent this degradation, especially when it comes to liquid preparations. So to help you to know what to apply, the type of preservative, if it is not extemporaneous dispensing. Another important area is the pharmaceutical technology. In pharmaceutical technology, there are some basic unit operations like weighing, filtration and sieving, dissolution. Many of them talk of size separation. You talk of size reduction. These operations are very important in dispensing, compounding and dispensing. So you cannot talk of dispensing without mentioning them. Another very important area is pharmaceutics. In fact, dispensing is pharmaceutics itself. That one is a broad area. But for the purpose of this introduction, we will not go deep into it. Another important area is forensic pharmacy. Forensic pharmacy. You have to know about the laws guiding the practice, ranging from even what you have compounded. What is the storage condition necessary for the integrity of what you compounded to be maintained? How can you store it? What is the label requirements? What is the direction on how to use it? These things are important. So all these things, not limited to what I have just listed, but they are very, very important in making sure that in giving the dispenser the knowledge, the basic knowledge that will help the person to do what? Dispense properly. In forensic pharmacy also, there are some drugs we call poison. That means this drug, each time you dispense it, you need to do what? Record properly. Because they are strictly meant to be dispensed with a prescription. Apart from general prescription drugs, we have the one we call poison. We'll go into that very deeply as we proceed in this course, dispensing. There's a very important word I used when I was defining dispensing. Without it, there will be nothing like dispensing. Is prescription. Now, what is prescription? Prescription is an order written by a medical doctor, veterinary surgeon, or any other registered health practitioner to a pharmacist to compound and dispense a specific medicine for a named patient at a particular time. This is the basic definition of a prescription. Thank you very much for your attention. See you next time.